All right, here in chapter 17, now that we've talked about the innate and the adaptive immune system and we better understand how the immune system protects us, now we're going to look at some disorders that affect the immune system. So just a quick kind of overview. I love this summary slide. I think if you can really understand what's the information that's in here and then the table coming up, this answers a lot of questions from this chapter in a nice compact form. So first of all, there are two types of immune disorders: hyposensitivity, so including a low, so the immune system isn't acting properly, so it should be responding to infections, but it isn't. So these individuals are going to be more prone to infection. It's going to take longer to get over them. And there are two types: a primary immunodeficiency. So this would be a disease, like the example here of severe combined immunodeficiencies, where either the B or the T cells are not functioning properly, they're not produced in enough quantity. So again, it's depressing our immune system. Or in the case of a secondary immune deficiency, this is caused by some other type of illness. So it doesn't directly impact the immune system, but it has an indirect effect. For example, individuals with AIDS. So again, it's caused by that virus. The virus doesn't necessarily directly impact or cause the immune system not to work, but because of that infection, because they're now infected with this virus, it is killing some of those T cells that are involved in our immune system. So the immunodeficiency is a result of some type of infection, so it's secondary. Then what this chapter mainly focuses on are hypersensitivities, so where the immune system is overactive. And there are four types. So type 1, this is what we typically think about with a hypersensitivity to the immune system. It's an immediate response, such as hay fever, anaphylactic shock, talking about food allergies, that type of thing. So when we think about allergies, this is mainly the type 1 hypersensitivity. Then with the type 2, this is going to be antibody mediated. So instead of an antigen causing an overactivation of the immune system, here there's an antibody issue. So it's mediated by those. This is mainly where we're going to talk about blood types and how there are certain types that don't mix and why that is. Then in type 3, this is the immunocomplex. So this is going to be the result of the immune system being activated, where those antibodies are binding to antigen. So like the agglutination that happens whenever a bunch of bacteria start sticking together and we get those antibodies. So that forms these immune complexes, and those can actually get lodged in places like our kidneys, and it can result in a hypersensitivity in those reactions. So increased inflammation that then can damage those tissues. And then in our type 4, this is going to be cell-mediated cytotoxicity. So again, this is activation of those cytotoxic T cells to an antigen. This is poison ivy is a good example of this. Also tissue rejection or a graft rejection. So trying to donate an organ or doing a skin graft and rejecting it, it is due to these cell-mediated cytotoxics. There's something where the cells are being attacked because they seem to have an antigen within them. And again, this other nice summary here is provided in this table. This is just of the hypersensitivities. So again, our type 1, these are the immediate hypersensitivities. So again, allergies, hay fever, asthma, anaphylactic shock, all of those go in here. The antibody mediated, again, this is going to be kind of our blood groups whenever we have incorrect matching, but we also see this with some diseases, an autoimmune disease called myasthenia gravis, also an anemia, where we're getting this, where it's mediated by the antibody overproduction. Again, the immune complex in type 3. So this is lupus as an example here. This is where, or rheumatoid arthritis, this is where we have these antibody antigen complexes, and it induces inflammation, and that overactivation of inflammation causes a lot of damage. And then again, the last one, the T cell mediated, this is those cytotoxic T cells that are getting activated, and those are being overproduced and killing cells that really don't have a dangerous antigen. Again, poison ivy, or a graft, a tissue rejection, where we're trying to help the person, but it looks foreign, it looks like it doesn't belong, so the immune system is attacking it. Right. Our overview here of type 1, essentially this is the same thing that we had seen with our B cell activation. So again, an allergen in this case, which is just going to be the antigen. So again, it's not actually harmful to us, but in that first response, we are recognizing it as an antigen, in this case also called an allergen. So that's going to go to our lymph nodes. The B cells are going to get activated. They're going to get confirmation from those helper T cells, again, as if it was something foreign, something harmful to us. That activates the B cells to produce antibodies from those plasma cells. Now, again, we have memory whenever we see that. So that sensitizing dose, that initial dose, then we're going to see those memory cells. And if we are re-exposed to that same allergen, again, hay fever, dust, things like that, that very first response may not be quite so bad, but every time we experience it after that, now we have that ramped up immune system thanks to memory. But again, we're going to get activation here of those mast cells that are secreting antihistamines and causing that allergic response. All right, some of the inflammation that occurs, cytokines are just chemical messengers involved in the immune system, and the effect that they have. So whenever they get activated by those helper cells, again, in that secondary response, prostaglandins are one of the cytokines that get activated. That's going to cause blood vessels to dilate. That's why we get reddening kind of the skin. Constricted bronchioles, going to make it hard for us to breathe. Whenever those prostaglandins act on our nerve cells, it can cause a headache or other pain to occur. Some other cytokines here, histamine, serotonin, and bradykinin, when they get released, they can also dilate the blood vessels. They can cause increased blood flow, can lead to like the hives that we see with some. Those also can impact the GI system, increasing peristalsis, where we're getting an increased flow of fluids through the GI that can lead to diarrhea and vomiting, as well as the secretory glands are going to get activated, so all the mucus is going to be being produced. And then finally, the leukotrienes, those cytokines would be released. They're going to constrict the bronchioles. We also get some mucus buildup, and this is what we see in the case of asthma that activates that. All right, so some strategies for blocking this type 1 kind of immediate response is first of all trying to prevent the entry of the allergen. So there are a few different ways here. So steroids are a common treatment. And what steroids do is they essentially stop the production of antibodies. So even though the plasma cell gets activated, it's not going to produce any antibodies. So it decreases the response because those antibodies aren't getting activated. What are called monoclonal antibodies can be given, and that keeps the IgG antibodies away from the mast cells. And so that'll help prevent that degranulation or activation of the mast cells. So essentially, we're using one antibody to attack another antibody. So we get these little complexes where instead of recognizing an antigen, it's actually binding to these antibodies that were released in the allergic response. And then antihistamines can be given, so like Benadryl, Claritin, all of those, and that's going to prevent the release of histamine. So that cytokine that we just talked about would then help prevent, even though the the immune system is active, it prevents that signaling through the cytokines. Of course, trying to avoid the allergen if possible. If we know we're allergic to penicillin, then that's noted and we stay away from those types of drugs. And then the other is a desensitization or allergy shots, kind of the idea behind these. And this is where essentially we try to train the body to get used to and then no longer have a hypersensitivity to an allergen. So say it's from some type of food or something, we add an altered form of the allergen. So similar to like a vaccine. So instead of giving the person the full allergen, it's something similar, doesn't actually create a response. So our allergen comes in here. These IgGs are going to bind to it, and that's going to prevent that allergen now is prevented from binding to the IgE. So again, kind of training it so that it doesn't recognize it. All right, now type 2, again, our main example here is going to be the blood grouping. So just a little bit about our blood groups. So there are essentially 4 blood types. So we have type A, type B, AB, and then O. And a little bit of genetics in here with that. So genotype are the genes that we have. We get a set of genes from each parent, so we have 2 of each one. So if we look at the gene that determines the proteins that are made, some of the genotypes, so A is a dominant allele. So the presence of any A would cause an A antigen to be presented on the membrane of those red blood cells. So that's where the name comes from. So these are antigens, again, that are presented on our red blood cells. So if somebody has type A, that means those antigens are classified as an A category. It's just a way of classifying them. Then blood cells can also produce a B. So again, it's also dominant. So any B means that that B antigen would be present on the red blood cells. AB is a combination, so they are co-dominant. So if both are present, then the red blood cells produce both A and B proteins to put on those membranes. And then O, the only way to get that is by being homozygous, meaning both parents gave us an O, and that stands for like the absent, so it has neither A nor B. Now where this becomes important here whenever we talk about the type 2 hypersensitivity is that if somebody is type A and they have these A antigens, then that would be recognized as self. However, that means that then they would produce antibodies against the B antigen because that seems foreign to them. Right? Then vice versa. If somebody is type B blood and they produce that B antigen, that looks normal. That's self cells. But then they would produce antibodies against the A antigen. That would be foreign to them. Now, if somebody is AB, then they produce both A and B on their cells. So they wouldn't produce antibodies for either A or B because both of them are self. They're both normal to that person. And then with our O, since they don't produce either antigen, they would produce antibodies against both A and B. The bottom here is just giving us some percentages. But what this is showing is, again, what these cells look like. So again, type A, we're just talking about a protein or a molecule that is placed on the red blood cells. It sticks off of that membrane. So it's classified as A. The B has a slightly different shape, where again, cells can produce both the A and the B antigen on their cells, or they cannot have either of them. And this is just how our own immune cells would recognize them. So again, if somebody is type AB, they have both, so they wouldn't make antibodies, but type O would produce antibodies to both. Again, where this becomes important is with blood transfusions. So we have a universal recipient and a universal donor, right? And that universal donor is going to be O, because they don't have any antigens on there. Okay, so they, if you give somebody who is type A blood, if you give them O, there are no antigens on those O cells. So our immune system wouldn't recognize anything, so it wouldn't create a response. So that type O is going to be the universal, I'm just going to put U. Ooh, it's really hard to write with this. Universal donor. All right. And then our universal recipient is going to be the AB blood. So since they have both antigens, they don't produce antibodies to either one. So if you gave somebody somebody that's AB blood, if you gave them A, again, it wouldn't look abnormal, it wouldn't look foreign, so no response would occur. If you gave them B, nothing would happen. If you gave them O, again, there are no antigens there, so none of that would look foreign. So this is the universal, and I'm just going to put REC here for universal recipient. So our type O is universal donor. They don't have any antigens, so it wouldn't look foreign because there's nothing there. And then AB is the universal recipient. They could get any blood type they wanted without causing a response. All right, along with this, we also talk about the RH factor. So blood is AB positive or AB negative or A positive, A negative. That positive or negative is for a completely different molecule that gets produced called, referred to as this RH factor. So this RH factor is also, if they're positive, there's an RH factor also on their red blood cells. So somebody's AB positive, they have an A antigen, a B antigen, and an RH antigen. All of those would be on their red blood cells. Now, again, with our blood transfusion, that needs to be the same thing too. So if it's somebody is AB positive, that's okay. But if somebody's AB negative and you gave them AB positive blood, they are going to recognize that RH factor as something foreign and would attack it. So again, if somebody is positive and you give them negative, that's fine. That would be okay. But if somebody is negative and you gave them positive blood, it would create an immune response. Now, what this picture here is showing is this can happen sometimes during pregnancy. So moms who are RH negative, so if their fetuses are also RH negative, then there's no problem. So there's no risk of having some type of the mom seeing the offspring or the fetus as foreign because they're both negative. However, what can happen is if they have one child who is RH positive, then that fetus is going to have that RH factor on their red blood cells. So what's going to happen is during pregnancy, especially during delivery, whenever that blood mixes, the mom is going to recognize that RH factor from the fetus is foreign, and they will create an immune response, and they are going to have memory cells from that. So it's okay during the first one, but what happens is because, again, some of these RH positive cells are transferred to the mom's bloodstream, she is going to have these memory cells that recognize RH as foreign. So now what happens is on subsequent, so now if this mom would get pregnant again and the fetus would be RH positive, now what's going to happen is the mom is going to start producing these antibodies against that Rh factor because it's foreign. Her cells don't have that, so it looks foreign to them and will start attacking the fetus, and it leads to what is called hemolytic disease in the newborn. Right? So then what happens to offset this is that moms are given what is called RhoGAM, which is an anti-Rh immunoglobulin during that first pregnancy and all the other pregnancies. And so the RhoGAM is going to bind to those Rh markers and prevent the mom from mounting a response. So essentially it's coating them. It's kind of covering them up so that it's hiding them from the immune system and they don't mount or don't cause that reaction. All right, so then our type 3, what we have here is, again, these immunocomplexes. So again, this agglutination we talked about in the previous chapter. So whenever antibodies bind together, because they have the 2 antigen binding sites, they can kind of clump together, and it can lead to what are called immune complexes, where we have antigen and antibody kind of forming these clumps together. And normally the immune system would get rid of them and break them down. However, if we get a bunch of these antigen antibody complexes, those can actually become lodged in the basement membrane of the epithelial cells of the kidney, of the lungs, and the joints and the skin. So in these particular locations, shown down here at the bottom, so these complexes, these clumps of antibody and antigen actually get lodged. And what's going to happen is that it's going to release histamines and other cytokines, and then those neutrophils are going to migrate to where those immune complexes are deposited, and they release enzymes that cause severe damage to those organs. So it can lead to kidney damage, or it can lead to joint damage, because again, the immune system is trying to get rid of these big complexes that got lodged there from an immune response. All right, and then our last hypersensitivity, type 4. Again, this is the delayed hypersensitivity, so like poison ivy would be an example here. So again, those chemical antigens or dendrites are going to go in and go through antigen presentation. It's going to activate those helper T cells. We get the memory cells here from that response. Those helper T cells are going to activate the macrophages. That causes an inflammatory response. And then we get activation of cytotoxic T cells that come along and lead to the death of the cells in that area. So that leads to those blisters that we see here with contact dermatitis. So again, we're getting an activation, but it's a delayed response to that. All right, and then some of our autoimmune diseases. So this would be where the immune system is attacking our own cells, and they shouldn't be. They are normal, they are self cells, but something has happened to them that caused the immune system to attack and destroy them. So some of the examples here, so lupus. So what happens here, this is systemic, so it's throughout the body, and this is where we get inflammation of a lot of the organs, and it's caused from antibodies against our red and our white blood cells, as well as platelets, clotting factors, and even DNA. So in lupus, again, this autoimmune disease where the immune system is essentially attacking the blood, and that, of course, would then cause different symptoms throughout the body. Our next one, rheumatoid arthritis. Again, also systemic, multiple types here, so type 2, 3, and 4, so it can involve antibodies, the cell-mediated, the delayed, and what's happening here is where the joint lining is being targeted. So antibodies against other antibodies, so that rheumatoid factor, and we also get cytotoxic T cell damage from the activation of those and the binding of those antibodies. So here the antibodies are attacking other antibodies in our joints, and it leads to that immune response and inflammation. In Graves' disease, this is affecting the thyroid. And again, this is an antibody-mediated response, so type 2. So here, antibodies are made against a hormone called thyroid stimulating hormone receptors. So it's going to damage those receptors. It's going to alter the thyroid's ability. It's not going to react or respond to this hormone, even though it's going to be released. And then the symptoms are based on essentially not having that hormone. Even though the hormone's there are no receptors to recognize it. And then the myasthenia gravis, this is only in our muscles. Again, another antibody reaction here, where antibodies in this case are binding to a receptor of a neurotransmitter called acetylcholine, and that gets released by neurons to cause muscle contraction. So this is a nerve-muscle junction. So then that messenger, that neurotransmitter, isn't going to be received. So it causes some different muscle spasms and different effects because, again, those receptors are not present to receive that neurotransmitter. And then probably one of the most common ones that you may be familiar with, type 1 diabetes. So this is the one that develops at a young age. Again, here the antibodies, or the cytotoxic T cells, actually, sorry, not antibodies, attack the beta cells in our pancreas. And again, this is type 4, is that delayed response because those cytotoxic T cells start recognizing insulin-producing cells as being foreign. So they start attacking them. Again, it's a delayed hypersensitivity, and now we're no longer able to produce insulin. And then finally, one to talk about here is MS, or multiple sclerosis. This is going to alter the myelin, which is the insulation around our neurons, especially the axon that sends out action potentials. So here it is both an antibody, but also a cytotoxic T cell issue, so type 2 and 4. So T cells and antibodies, again, are going to recognize myelin sheaths as foreign and attack them. And then finally, just back to the immunodeficiencies. So again, there's primary and there's secondary. Primary is where, again, there is either an autoimmune disease or there's something that is specifically targeting those immune cells. So a few different examples shown here. So severe combined immunodeficiency. This prevents the lymphoid stem cells from being developed in the bone marrow. So they're not going to produce either B or T cells because they both originate from lymphocytes. And so in this disorder, they don't produce any lymphocytes, so they can't make T cells or B cells. So they have no way of recognizing antigens. Then in DiGeorge syndrome, this is going to selectively alter those T cells. So we're not going to get maturation of the T cells in the thymus. So there's still B cells that can be activated, but those T cells cannot. And then adenosine deaminase, ADA deficiency. Here the T cells are made, but they are not going to be able to release an enzyme to actually activate that response. And then a couple that affect the B cells, so congenital gamma globulinemia, is going to prevent the maturation of B cells in the bone marrow. So very similar to DiGeorge and the T cells, the B cells start to be produced by lymphocytes, but they don't mature in the bone marrow. And then our hypogammaglobulinemia, that does not roll off the tongue well, as well as just a lack of regulatory B cells. This is going to prevent B cells from actually producing antibodies. So the B cell matures, but it doesn't activate. And then again, our secondary immunodeficiency would be the result of some type of infection like HIV, that then compromises the immune system. Right, and that's the end here for this chapter.